Today we want to look at rapid diagnostic testing. So rapid diagnostic testing, we've got a variety of tests you can do. So we want to look at now rapid diagnostic testing for malaria. So we have this testing kit here so that we show you how to use it. Now before you start, since we are on the ward, this is not really OSC. On the ward you have to go and wash your hands. So hand washing, as usual, goes in with the 12 steps. So that will be quick. Okay. So make lather, okay, then that. Okay. Since we are dealing with a patient, you have to wash hands thoroughly. Okay. Go there. Good morning, Lydia. Okay. I am, let me say, student. In this case, I'm simulating. I'm a student. I'm student number 2 from Rusangi University. I've been assigned to take a rapid diagnostic test on you. May I please go ahead? Okay. Is there anything I can do for you before I begin? No. And this is more like OPD setup. So you have to just do it. There's nothing like a bed and all that. So here, what you have is the rapid diagnostic test kit. Okay. So this is how it looks. You're going to open using those, okay, so the zigzag. You're going to follow it, and then do that. Okay. So this side as well, you can try to open it. Okay. Or if you have the scissors, you can quickly use the scissors so that it comes out as fast as possible. So this, when you see the test has got only maybe one port or this side here, you can be able to see there are two here. There is a PF. PF means that this is for falciparum. Then this C, it can it's the control. So meaning that if it gives you double line here on the control and the PF, meaning that it's a positive malaria test. Now you'd find that it has a 3, where it will give you any other parasite for malaria. So meaning that that's a multiple test kit. Now this one is a single test kit. It only gives you falciparum. Then you're going to drop blood here on this port here where there's this dot for blood. Then here you're going to put a diluent. So this comes with a diluent, which is here. Okay, so I'm going to put about 2 drops of a diluent here so that it mixes with blood over there. So other things that you have, this is the lancet for pricking the patient. We're going to remove this piece of plastic so that to remain with a needle cut. Okay, then here what we have, as you can see, is inverted cup or blood transfer device. So we're going to scoop blood using this device. So let's see how we start. Okay, then here there's alcohol pad, okay, or prep pad. So I'm going to open this. So here, let me just swipe. So which finger are you comfortable with? Okay, so mostly people would want the thumb, but then you would also tell the client that maybe the middle finger is preferable because it won't be painful. Okay, so you go with the middle finger. So you just swipe there. This is alcohol, okay, prep swab. So you just swipe. Then after that, you can get the lancet. So I'll be able to prick you. It will be a little bit painful, but just more like a sting, okay? So you go there, okay, and then don't go in the middle because there are bones there, or there's a bone. Go on the side so that you avoid that bone. So just go on the side there, okay. So as you can see, I pricked. Okay, so you get this uh, inverted cup. Okay, so when you get the cup, there's this part here we're supposed to scoop the blood. So you go like this. Can you just turn? Okay, then do that so that you have enough blood. Then put there. So the cup is full, as you can see. Then you give a patient dry cotton wool to put there. So after that, you're going to get this here, the kit. Then just turn it and do that. Once you do that, meaning as you can see, blood has moved out from the cup, it is there. So you quickly get the diluent and put 2 drops. Okay? So you can put 2 you'll be able to observe how it will move. Okay, so at least just be there to watch how the movement will be. So already it's moving, as you can see there. Blood is disappearing there, showing that blood has moved towards the control and where it's written PF. Okay, so you have to wait. So already the diluent and blood have come this way, where it's written PF and C. Okay, so you have to wait a little bit longer. Okay, so don't put too much of the diluent, because if you put too much of the diluent, you discover that as you continue doing your tests, you won't have the diluent. The diluent will finish even before the test gets finished. So do not put too much. 2 drops are enough for it to work. So that's the blood and the diluent which is going on there. At the moment you can't still read because it's the process hasn't yet finished. So in this case, as you can see, it's already clearing up, so that you can also start now observing. It's clearing up and you can be able to see the line for the control already. Okay, so the line for the control is beginning to show, but at this moment you cannot confirm the result because you have to wait a little bit longer. So at this moment, if maybe a patient has got concerns, you can talk to the patient as you wait. So at this moment, as you can see here, the line for control is visible, but for PF, it's not visible. So this reading will show you that this is a negative malaria test. So if you saw 2 lines, like this line on the control, if it were to appear here on the PF, meaning that falciparum malaria is positive. Okay, so in this case, there is no line here. Okay, so it's negative. So Lydia, as you can see, you don't have malaria. You're okay. And for the fever that you are able to complain about, we'll try other tests. So you can send the patient to do other tests, or if you are doubting this, you can try to do a blood slide and also try to do other investigations that are causing fever. If it's flu, you can also investigate to find out, or maybe during your history taking, you can discover that it's a flu. So you can just give treatment accordingly. So at this moment, since it's negative, you proceed to do other investigations. So thank you very much for watching. But then what you need to do, since you have touched this, you have touched the patient, you have to dismantle and also wash your hands. So you're going to wash your hands the usual way. Okay, that's what we do for this test. Thank you very much.